name is Jonathan Oye, and this is week 9 video for AK. First, we're going to start off with the neck extensions that are associated with the lumbar. I'm going to have the patient in a Superman pose and have them bring their neck into extension. And I'm going to push down, they're going to resist. Okay, 5 out of 5 strong. Next, I'm going to assess the SI. To assess the right SI, I'm going to have the patient extend and rotate to the right. And I'm going to push down and have them resist. To assess the left SI, have the patient extend their neck, rotate to the left, resist. Okay, to assess the sacrum, I have the patient rotate to the left and right and assess the neck extension. So extend, rotate to the right, resist, then rotate to the left, resist. Okay, next we're going to do the TO junction, which is associated with lower trap. So I'm going to have the patient arm out, thumb up, at the angle of T12, the TO junction, and I'm going to push down and the patient is going to resist. Hold. Okay. Next, we're going to do the CT junction, which is the middle delt. Okay. I'm going to hold under. I'm going to push the arm down. Hold. Okay. Next is the glute max that is associated with the upper cervical due to the lordosis. Have the patient extend their hip. And then we'll push down on the leg. Hold. Okay. Next is a popliteus. I'm going to start the patient's foot in internal rotation. And then I'm going to try to bring it out while they resist. And this is associated with the lower cervicals. And last, I'm going to have the patient flip over supine and assess the psoas, which is associated with the occiput and atlas. So I'm going to have the patient's leg out, turn out, so hold. Okay. Okay, next I'm going to test the teres major, which is associated with thoracics. So I'm going to have the patient put their hand on the middle of their back. Okay. And have them push all the way up, and I'm apply force into the humerus. Okay, hold. Okay, and strong 5 out of 5. Okay, I'm gonna demonstrate for y'all the fixation of the occiput. So first, I'm gonna test the psoas muscle bilaterally, and normally to find a fixation of the occiput, both psoas are gonna be weak. So, but we're gonna both test psoas, hold, and it's weak 4 out of 5. And I'm going to go over and test the opposite side. Okay, hold. And it's a 4 out of 5. So next I want the patient to therapy localize behind the occiput. And I'm going to retest the muscles to see if it gets strong. Okay, hold. And be strong 5 out of 5. Okay, put your hand down. And therapy localize with this hand. And I'm going to hold. And it goes strong 5 out of 5. So now we know that it is an occiput fixation. Put your hand down. So what we're going to do, we're going to go back. I'm going to have the patient slide off the table, and I'm going to check for a tight and tender nodule. It's either on the right or left side, and with this patient, I'm feeling the right side. So what I'm going to do, I'm going to take my MCP of my right hand and slide it under the patient's occiput where the tight and tender nodule is, and I'm going to line up my elbow with the patient's glabella, and I'm going to apply a gentle thrust into the tight and tender nodule to release the inflammation. Okay, so now I'm going to go back, have the patient slide on the table, and we're going to recheck both psoas bilaterally without therapy localizing. So, come up, hold, strong 5 out of 5, hold, strong 5 out of 5. Now I want you to therapy localize, put your hand behind your head, hold, 5 out of 5, put your hand down, therapy localize with this hand. Okay. Hold up. And 5 out of 5 with this leg too. Okay, now we're going to do the muscle testing for the back scan. So first we're going to do rectus abdominis. I'm going to have the patient put their arms right in front of them, and I'm going to push. I'm trying to pull their knees away from their upper body, so hold. Okay. Next we're going to do the oblique. So I'm going to have the patient rotate to the left. I'm doing the right external oblique and left internal oblique. I'm going to apply force into the shoulder. Hold. Okay, next I'm going to have them rotate to the opposite side. So we're going to do the left external oblique and right internal oblique. Okay, hold. Okay, next we're going to do the QLs about the patient supine. So I'm going to do the left QL. I'm going to reach under the patient's leg, put my other hand on the trochanter, and I'm going to pull towards me, hold. Okay, next is rectus femoris, and raise the leg up about 45 degrees. I'm going to apply force straight down, hold. Okay. Next is iliacus. I'm going to have the patient's leg straight up like this, rotate it out, and then I'm going to push down, hold, Okay, strong. Next is going to be the psoas muscle, staying right here. I'm going to put my hand on the ASIS. Patient's leg is up 45 degrees, out 45 degrees. External rotated. I'm going to push down, hold. Okay, next is a sartorius. Bring the patient's leg in, hold. Okay, next is the gracilis. So my patient's legs down, rotate it in. I'm going to pull, have my hand under it, and I'm going to pull out. Adductors, foot straight up. I'm going to pull out towards me, hold. Okay, next is the glute medius. I'm going to take the patient's right leg and hang it off the table, and I'm going to try to force it inside. So hold out, so I push it in. Okay, next is the TFL. I'm going to bring the patient's leg up and out, up and in, I'm sorry, hold. Okay, then next is the medial hamstring, so now the patient go prone. I'm going to flex the leg to 90 degrees, and I'm since this is the medial hamstring, I'm going to have them rotate their leg out, and then I'm going to push out as they try to push in, hold. Okay, next is the lateral hamstring. I'm going to take the leg medial, and I'm going to push out while they hold in, hold. Next is the bicep femoris. I'm going to put the leg straight ahead at 90, hold. Okay. Next is the piriformis. I'm going to put my knee right here so the leg doesn't slide off. Bring the leg in. I'm going to try to pull out as they hold in. So hold. Okay. Next is the glute max. Have the patient extend their hip. I'm going to put my hand on the sacrum and hand on the back of the leg. I'm going to push down, hold. And next is the sacrospinalis. So I'm going to put the patient's arms down. Have the patient bring their arm up. I'm going to stabilize on the back by the sacrum. So apply force down, hold. Then have them go down just a little bit, hold. And then down a little bit more, and hold. Okay. Okay, now we're going to assess the muscles associated with the ankle. So first we're going to do tib anterior. So I'm going to push down and out. Tib posterior, I'm going to go up and out. Peroneus longus and brevis, I'm going to go down and in. And next is peroneus tertius, I'm going to go down and in. The next is going to be the gastroc, which I'm going to have the patient slide back just a little bit. I have the patient foot like this. I'm going to cup my hand under the calcaneus, and I'm going to pull out while the patient holds in. Next is the psoas. Flex the patient's knee, and then I'm going to try to force their foot up. Okay, hold. And that is all the muscles of the ankle.